Okay, what's gonna happen if you lesion the trigeminal nerve? You have, let's imagine you have a stroke in the trigeminal area or an infarct. So what's gonna happen? One thing, you're gonna lose facial sensations. Okay, facial sensation is gonna be lost. So you cannot detect anything on your forehead, on your cheek, or your chin. You cannot detect anything inside your mouth. Not taste, obviously, but any crude touch or anything like that. Pressure. You cannot detect tongue sensations or your mouth sensations. This the muscles of mastication are going to be affected. So what will be the result? You cannot chew the food properly. And how will the patient present? Because of the loss of pterygoids, the jaw will be deviated towards the side of the lesion. Why? Imagine this is the person's face again, a very bad representation, and the mouth. Okay, the pterygoids are actually the muscles which are pushing the chin. Okay, the pterygoids serve to push the chin like this forward in opposite directions like this. This is the medial and the lateral pterygoids. Okay, so they push the chin. So any where this is damaged, okay, for example, if this pterygoid is damaged or if the nerve supplying this pterygoid is damaged, what's going to happen? This pterygoid is going to overwork. It's going to push the chin in this direction. So the mouth will be deviated towards the lesioned side. Another important manifestation of the loss of trigeminal function is hyperacusis, or because of owing to the loss of the tensor tympani muscle. Now, why does this happen? Imagine this is the eardrum, okay, in the ear cavity, and this is the handle of the malleus, this is the incus, and this is the stapes. Okay, and this is the footplate of the stapes, which is towards the oval window, and this is the cochlea. Okay, now the tensor tympani muscle is attached to the handle of the malleus like this. Okay, now the function of this tensor tympani muscle is to, when it contracts, it limits the movement of the malleus. So no loud sounds are actually transmitted to the cochlea. Let's imagine if there is this bomb explosion over here. Okay, this is a bomb explosion right over here. These waves are going to transmit to the eardrum, which is going to vibrate like wildly and transmit all that sound towards this cochlea. Now, if this tensor tympani doesn't work, all this sound is going to transmit and is going to damage the cochlea and the hair cells within it. So this tensor tympani contracts, it limits the movement of the handle of the malleus and hence protects the cochlea and the hair cell within it from getting damaged. This is one of the functions of tensor tympani. So if it is lost, something called hyperacusis or loud sounds, you'll start hearing loud sounds even when there are no loud sounds around. Sorry, acusis. So hyperacusis is gonna occur. Okay. So this was a manifestation of the lesion of the trigeminal nerve. Okay. Now these are all the lesions. I'm just talking about the lesions right now. Another function, another clinical pathology associated with the trigeminal nerve is what's gonna happen if this trigeminal nerve starts going wild and starts firing signals on its own. What's gonna happen? This facial sensation is gonna be exaggerated. Okay, you're gonna experience something painful on the face, pain, terrible pain, this throbbing pain, also known as a trigeminal neuralgia. Or as the French will say it, a tic douloureux. Okay. Now, just as a side note, anyone remember what is the treatment for trigeminal neuralgia? If you're saying carbamazepine, you're absolutely correct. Trigeminal neuralgia is treated with a drug that blocks sodium channel conduction and nerve conduction. So carbamazepine is actually the drug of choice. Okay, and this concludes our lecture on the trigeminal nerve.